My name is Bob Waits. I'm a specialist health facilitator and I'm based in the Cheshire and Wirral Partnership NHS Foundation Trust. So I'm a learning disability nurse by background. So one of the things I'm going to talk about is what physical health monitoring may be needed for when going through the processes of a child with ARFID. So we'll talk about things like weight, height and BMI. So it's really important to ensure that those are monitored, as that'll help you track through any changes or developments that you have. Things like monitoring the rate of expected growth for the age of your child, that's really important as well, but it's also very important to make sure that that isn't the only factor that's monitored. Making sure that other health factors are taken into account is really important, because weight for a child may increase, but there still may be a nutritional deficit. So things that also may be done include blood pressure. That may be done lying down, standing, to check for any changes when that occurs. You'll also look for things like skin changes that may indicate nutritional deficiencies that are present that may not be obvious through other factors. Looking at blood tests. Now, I recognise that these may be quite difficult for some individuals. There may be alternative methods to having to take bloods. People can really struggle to have venous bloods taken, for example, and so we may have to look at different methods for that. However, the reason for bloods is to look at those nutritional imbalances. For example, excess sodium or other imbalances depending on the type of food intake that your child has. We may be looking at things like anemia, iron deficiency, liver and kidney function, including things like thyroid function as well. But it's really vital to ensure that we rule out those physical causes before we go ahead with any of those processes.